Welcome to another episode of the EyePros Podcast. I'm Yasmine Abdalla.
I'm Ahmed.
Today, we're discussing a very important topic, heat wave, and what can we do about it?
Eye problems during a heat wave. So I think, with all this heat, we all really struggle and then sit in front of fans and air conditioning if we find them all day.
So you're lucky enough to find them?
Yes, and we sit in front of them all day. But this is not very easy on the eyes, is it?
No. With this lovely weather we are having a lot of problems because it was the spring before, so the pollen count is really high, so people with hay fever are really struggling. And then just to be topped up by the extreme heat, which in itself could be an issue if you've got dry eyes and allergies. And sitting in a fan could dry your eye quicker, and sitting in aircon also causes the same issue. So people are getting very symptomatic with their dry eyes and allergy. And we're getting lots of them coming to acute eye clinics or calling us at clinics saying, things are not really going well.
Yes, and even our regular dry eye patients are struggling nowadays, and they're finding that they need additional treatment, they need more drops, etc. It's just, I think, being cautious about things. But I can't tell you to just sit in the heat and tolerate without air conditioning. It's just be cautious about it. So in contact lenses in particular, if you have your contact lens on, which can cause the dryness to be a bit more exaggerated, then adding the aircon doesn't really help, does it? And you just use your lubricating eye drops maybe a bit more regularly. But red eyes, we have seen a lot. So some causes of red eyes can be very simple. So pollens is a good thing. So I never had hay fever myself, but with the very high counts of the pollens, there's just so much pollen that it can affect even people who don't have allergies.
Let's pedal back a bit. So what is dry eye?
So essentially, dry eye disease happens when the tear film on your eye doesn't stay long enough on your eye. Okay, so the tear film itself has 3 different components. It's mostly water or a fluid, and it has some minerals and other things, but essentially it's water. About 90% is water, and then this water is covered by an oily layer. Okay, and the oil has to have specific characteristics to stay long enough on the eye to protect the water. Because if you have the water on its own, just like if you have a bit of water spilled on the walkway, then this evaporates. It doesn't stay long. And same on your eye. If you don't have anything to protect the water itself, it can evaporate too quickly. Okay. Obviously, we have the blinking reflex that spreads the water and spreads the oil on top of the water. And the oil essentially protects the water from evaporating too quickly. Okay. Now, sometimes the glands that are essential for producing this particular oil, they reside here on the eyelids, and they open on the eyelid margin. Sometimes they become dysfunctional, we call them. These are called meibomian glands. So there is something called meibomian gland dysfunction. So these glands, they don't secrete the oil properly, and the oil secreted doesn't protect the water from evaporating too quickly. So this is called evaporative dry eyes. Now, some studies found that as many as 87% of patients have evaporative dry eyes of some sort. Obviously, not all patients are symptomatic, but it is something that's very, very common.
What are the symptoms? So does the eye feel dry?
Yeah, so you feel gritty. You feel there's something inside your eye. The eyes, they become tired. So if you feel that your eyes are a bit tired, you want to, you basically want to like go sleep or keep them closed. And they feel gritty. There's something in them. They feel sore.
There's also the watering when you're sitting in front of that fan.
Yeah, that's correct. So even when people go outdoors, it start watering, and then they come because of watery eyes. And it's a very counterintuitive thing, because my eyes are watery. So how come you're telling me it's dry? It's the brain feeling that the eyes are dry, so it's sending signals to the water, the tear glands, to produce more tears. So you end up with watery eyes.
On your cheeks.
Yeah, there's it can be so bad. Obviously, if there is blockage in your drainage, the tear drainage system, they can also end up with water eyes. But most patients will just have dry eyes, and that's why. So when you treat dry eyes, the watering stops.
So a lot of patients ask, there's lots of options out there over the counter, and you can buy from your local pharmacy or from your optician, but people find it difficult to choose. So is there an art to it? Is there a science to it? Does people, well, being 87% of the population, that's a very common condition. So do people self-medicate like hay fever, or is it better to see a professional?
So it really depends on the type of dry eyes you have. So we spoke about the evaporative type. There's also something called the aqueous type, which is the water component is less. So your tear glands produce less water. And this is much less common, and it's because of several conditions, inflammatory conditions, etc. And there's mixed type, obviously, with a bit of both, essentially. So you really need to see a specialist, so we can identify what the problem is and then treat the root cause. So if it's a watery problem, then we treat the inflammation. If it's an evaporative and the oily gland problem, then we treat those glands. And if it's mixing, then we address all the problems. We can just symptom relief, and this works for some patients.
Which is the drops.
Yeah, just get some drops over the counter, and if you're happy to use it 3-4 times a day and it's good, then that's fine. And if it works for them, then that's great. They don't need to do any further assessment. But some people need specialist assessment to find out if there's something more they can do for the dry eyes.
So what other innovative treatments do we have in EyePros that you want to share with our audience?
So for evaporative dry eyes, we have something called intense pulse light, or IPL in short, and many people have heard of it already. So essentially, it's a light treatment, just like we have for macular degeneration and things like that. It is, we're finding this magic of light, how it treats things. So this light, when you have those intense pulses of light directed at the nerves that go into the glands, so we direct it kind of around the face here, and it stimulates the nerves going into the glands, and this stimulates the glands to produce better oil. They have better structure and better function. Okay, it reduces the inflammation as well. So it reduces the amount of parasites on the surface. So it improves the ocular surface function as a whole. Now, we don't do it arbitrarily as well. We have a diagnostic suite that goes with it. So we measure everything in the eyes. We measure all the components and all the different aspects of this, and then we tailor the treatment to what you need.
So the patient would actually be able to look at their actual tear film and look at the progress with every treatment.
Yes, that's the idea. So we do scans, and then we show progress with the scans. And if we don't have progress, then we don't offer the treatment. And the algorithms, we worked out very clever algorithms that tell us, okay, this patient, they will improve or they will have some benefit, and this patient is unlikely to see any benefit. And it's up to the patients at the end. But there are patients that we have to turn away.
And
Not
this
many.
is an ongoing thing? Is it an ongoing? So do I have to do it every month, every year, every blue moon?
So when we do the first course, and we do it like a course of 4 treatments, about 2 to 3 weeks apart. So it takes about 3.5 to 4 months to finish that course. And we don't offer the treatments solo. So you have to have this course to start with. In many patients, this just kicks off the system. So the nerves are improved. They improve the structure, improve the function, and this just kind of it's just enough for them to improve. And some patients we don't see anymore. They're very happy with this. They have some drops occasionally, but they can tolerate them, and it's okay.
That's quite impressive.
Yeah, some patients will have 1 or 2 treatments additional every year. So it's not something that you have to keep doing intensely all the time. You have the initial course first. You have initial course of treatment. We do have patients that need this more often, so we just offer it to them.
And how long does every treatment last? Like, what's the patient's journey like? They come to the clinic, then what happens?
So we do the initial assessment first and decide what treatment course is good for them. If it's an aqueous thing and it's medical, then we give them a course of drops. Sometimes we give them a course of antibiotics or tablets or things like that initially. So it's a complete solution. And then what we offer at EyePros is something called the eye spa protocol. So it's a series of different treatments. So they get some heat treatment and vibration massage treatment for the eyelids first, and then they get cleaning of the eyelid margin, and then they get the IPL all in one setting.
So what's the time commitment for this? So how long is the
About
appointment?
It takes about, let's say, about between 45 minutes and an hour. So the actual treatments take about 20-25 minutes, because there is different steps and
Is
there
it
are breaks
painful at
between
all?
them. No pain at all. Well, it's nothing. It's
It
a bit
doesn't
of
require
massage.
anesthetic or anything like that.
No, it's nothing.
So
like
strictly
that. It just takes time.
outpatient.
Yeah, it's strictly outpatient. You said it's a nice treatment room. You know,
It is an actual spa.
it is like a spa. So like spa music, nice smells, and it's a different experience. It's like a spa for your eyes. I mean, they convinced me to because I was a bit skeptical about this and how this works, etc. I read all the documents and all the trials, and it really works. The science checks out. But I tried it myself as well.
Oh wow,
And I felt really, I felt refreshed afterwards. I have very minor dry eyes. I don't usually treat it, but I thought I'll try it, and I felt refreshed. I felt as if I came out of a spa. So that's why we registered the eye spa. So and this is something, and just this is
I
a
think
protocol.
that's
That's why.
one for me to try.
Yeah, it is. It's a very refreshing thing, and it's meant to kind of. We do offer other things, to rejuvenate the eyes, etc. But as part of it, when your eyes are fresh, you just feel fresh. Your eyes feel better, and it lasts for a few days or sometimes weeks, where your eyes just feel better. Especially when you finish the course, you don't nearly need the drops as much. But many people, thankfully, there are practices now that are starting to offer this. But the specialist dry eye treatments and looking at the patient holistically, we look at their nutrition sometimes, we look at different things and their lifestyle, how to change and how to modify things. So it's we take a holistic approach in treating dry eyes. And then we have enough training now to pursue it to even the next level. So they have very advanced complex ocular surface disease. We're equipped to use that, amniotic membranes and other things as well. So we can offer these things that are extreme, but thankfully not many patients require that.
That's fantastic. Are there any side effects to the treatment?
There are cautions. So obviously it's a light treatment. So and we are working with nerves. Some diseases that affect nerves, like cold sores, can reactivate. People who have shingles, let's say, they can reactivate. So it doesn't mean that you can't have the treatment, but people just need to be cautious. And that's why it's good to have it with consultants like us. Yeah. So it's because if there's any issues, we can treat them. There are active skin conditions, or they've had skin tumors or things like that, then we are more cautious, of course, about this. It can increase the susceptibility to sunburns. So we always tell patients that, and use more sunblock. And in very sunny days, we actually applied sunblock on the patients before they left the clinic.
Oh, so you have sunblock in the clinic?
Yeah. We have that, and we have treatments afterwards as well. We put some things on the face and things. That's why it feels refreshing. But sunblock was one of the things when it's very sunny.
I think we should add hats to our merchandise.
Yeah, possibly. With ice spot.
Hats.
Yeah, of course. When patients come to see us for dry eyes, it's not just the dry eyes that can be a problem. So they have sore eyes, they come and see us. Sometimes it's something else. So they have redness in the eyes, and they have this feeling of dryness and of grittiness. It can be something like allergic eye disease. This can be, or patients know it more as hay fever. And hay fever obviously affects your nose, and you get a runny nose and things like that, but it also affects the eyes. And it can be they have a runny nose because of all the tears going through the system. So they go in and drain through the nose, so you have runny nose as well. It's not because it's affecting your nose, it can be just the eyes. And we treat that. So there are drops now that can treat both the dry component and the hay fever or the allergy component. And the allergy itself needs a bit of understanding, because some of the over-the-counter medication treat the allergy before it happens, but once it happens, it doesn't have any effect. And then some medications actually treat the allergy itself, and they are antihistamines. Just like the antihistamines you take orally, there are ones that you can take just as drops. And the oral antihistamines also help, but they can have like a bit of a more generalized effect. So it can cause sleepiness, etc. But they do help, but you don't really need to have, if you don't have any other symptoms, then you don't need that. But even those patients who have those extended symptoms, we can treat them. They can also have infections in the eyes sometimes, something called like a viral conjunctivitis, essentially a cold, same virus that causes
That's more in the
cold.
winter though.
Yes, it's more in the winter, and it's usually following a cold episode. But people get colds in the summer all the time, so they come and see us, and it's quite contagious as well. So it can get infected from other people that have it, even from animals. So it is something that we see sometimes, runny eyes or sore eyes, things like that. And it can be more serious. So contact lens related, they can have an infection from contact lenses, or it doesn't have to be an infection. It can be a reaction from the eye itself to the contact lens. It can be an allergic reaction from the contact lenses. Or it can be uveitis. Like I'm sure you see some of those.
Of course. And I've got something also that is very common nowadays. All the ladies are going for those lash extensions before holidays.
Yes.
And I'm getting lots of allergic eye disease secondary to lash extensions. And
Oh,
because they're
really?
very expensive, people don't really want to take them off. But I find that it's mostly the glue used that causes
interesting.
problems. So
Yes.
I think also we're getting a bit of an outbreak of lash extension related problems.
That's okay. Maybe we can describe that, write it up as a publication.
Lash extension related issues. But
Yes.
I've seen lots of allergic, like, other than the one DIY job that went really bad and the patient's eyelids got glued together and we had to spend days trying to apply them.
Oh, wow.
But what is more common is that they get reactions to the glue. I don't know what glue they use, to be fair, but they can get reaction to the glue itself. And I don't think it's the lashes themselves, to be honest.
Yes.
And the other thing is if they're not applied properly, because obviously technicians who do it, they're not using groups, they don't know where they're putting them. They can cause lots of irritation to the eye,
Yeah.
because technically it's a foreign body rubbing against your eyelid every
Of
time
course.
you blink. So this is an interesting one that I see over the summer months.
It is interesting, and the other thing is, we have to be also sensitive and conscious about that. People have booked their holidays, months in advance, sometimes years in advance.
Yes.
And then you're coming to essentially tell them that, it's because of something that they've done to enjoy the holiday more. They're now getting, they might not be able to go on holiday. So obviously we try to be more conscious of that and try to treat it as much as possible, and maybe lose the extensions, but you can have your holiday. But it is something that very sympathetic with patients. All of us booked the holidays in advance, and we're very excited about it and do some things. So it is something that obviously we keep in mind. But thankfully most of them can be treated easily and without consequences. But tell us about the times when you have to be careful that it's actually something to be aware of, like uveitis and other things.
So obviously with people who are contact lens wearers should never take a red irritable eye, red watery eye lightly. They have to have someone check them because it could be serious corneal ulcer or infection.
And times of the essence in that one. I
course.
remember when I did my PhD in the lab, the bacteria can destroy the cells completely within a few hours.
So they've got to be really cautious. Again, it's very hot. People tend to jump in the shower right away without taking their contact lenses. It's really hot. They doze off with the contact lenses in.
Especially in a hot tub.
Or even worse, or in the pool, which
Yeah.
is very high risk behavior.
And they're like, oh, I'm keeping my head above the water. I'll keep
You're
my
not.
head dry.
You're not.
Doesn't work like that.
Because
Splashing
and there's
everything.
splashing, there's steam coming out of it. So that's another very important one. I don't know about hot tubs in this heat. I think people need to be in ice tubs, but that's another story.
They can use warm tubs. To keep them.
Tubs.
Yeah. People use it. That's what's accessible to them. But essentially, any body of water, really, you have to be cautious around contact lenses.
That's the thing, because it's really hot. People can easily forget, because you get really tired, you get heat exhaustion, and you just want to get under that shower. So being in your contact lens is a risk factor. So if you get, after such an episode, you get a red eye with watering, you have to see an eye professional on the day, and time is of the essence, because you can very quickly lose your vision.
Right. Any other problems as well that can develop?
So there's the other thing more related to me is uveitis. So that's inflammation in the eye.
Yeah.
So
iritis, some people call it.
Yes, iritis. So basically it's inflammation. It could be anywhere in the eye in different layers. The most common one is the iritis, obviously. If you're someone who knows themselves to have an autoimmune condition that can precipitate this usually patients are very good and they're very savvy and they know the symptoms. It's your first episode that can be deceiving. It's a very common thing where they go see the pharmacist or the GP, they get a course of 𝗑𝗲𝗃𝗃, it does nothing.
It's just an antibiotic.
Exactly.
No
and then the
infection.
vision just keeps getting worse. The pupil shape might change a little to the extent that they can see that. And then they present late. So again, this is something that needs to be seen by a specialist.
They can just go to their opticians to see them. Isn't that
Any eye specialist. So
Yeah.
opticians can recognize it and they can do the referrals very promptly to the hospital. Most hospitals really have excellent relationships with the community optometrists who actually give us most of our patients in the sense of they can recognize the signs and they can send the patient through, and they can also tell how urgent it is to see. And then when they're not sure, they can always call the hospital and ask how urgently do you need to see that patient. Is it a matter of hours or days, or is it a matter of weeks and months?
Yeah.
With uveitis, obviously it's hours to a day, maybe two. With corneal ulcers, it's hours, like on the same day you need to be seen because it could be something potentially very serious.
And patients with private medical insurance, they're more aware of that as well, and they can come and seek private treatment for that.
I think the bit that many of the community optometrists, as excellent as they are not aware of, is the option of private practices. So when a patient goes to the optometrist and, for instance, they've got uveitis, the knee-jerk reflex is, let's send you to the hospital, which is absolutely fine. But again, it's an acute eye care department or an A&E department where you have to wait until someone or the duty doctor sees you. Well, the advantage of seeing someone privately, if they've got availability, you can see them on that day or even next day, but you see them right away, you see the correct person right away because you know the subspecialty you need. And it's really quick. So I think this is a bit where EyePros again becomes very useful, because that's the gap where a lot of people have private insurance, but they don't know that even for acute issues, they might be able to see. I've just seen a little kid with allergic eye disease because dad had insurance for the family, and they called and they said, okay, which consultant can, see that patient? And I did, and they've done really well.
Yes, and it's something that we are seeing more of now. More people are aware of it. And that have a private medical insurance, or you just want to seek private treatment, you can just book it in. You can book yourself in, give us a call, and we can sometimes give information over the phone as well. Consultants can do a consultation.
To be fair, between both of us, I think we cover all days of the week.
Yes, exactly. So that's good to know. And there are things like also, scleritis and 𝗵𝗵𝗁𝗍𝗃 and things like that we covered as well. So not all soreness is just dryness or allergic eye disease. It can be other things as well.
I'll flip that straight at you. It can also be acute angle closure glaucoma.
Yeah, of course. I mean, this is a bit more dramatic though. But we do tell patients to seek help when this happens. Some people say, well, I'm seeing my optician in a couple of weeks, I'll just wait until then. So it is better to actually go and see someone.
Absolutely. And with 𝗵𝗵𝗁𝗍𝗃 and scleritis, just going back to that question, again, 𝗵𝗵𝗁𝗍𝗃 is pretty simple. Not much more complicated than dry eyes. The treatments are not that much complicated. So it's more like 1 or 2 consultations, some drops and some lifestyle advice, etc. Scleritis is a bit more complex because it can have an underlying cause, just like uveitis, and it could be a sign of a more serious condition depending on the age of presentation. It depends on the patient. So patient's age, where exactly in the sclera, how it's looking. So again, that is a more serious condition, and usually a lot of pain is involved as well.
So in this weather, what would you advise people in terms of sore eyes, dry eyes?
First of all, a bit of general advice: stay cool, wear your hats, and wear your sunscreen.
Okay.
And don't get your sunscreen in your eye.
Of course.
Avoid contact lenses if you can.
Or use them judiciously.
Exactly.
A few hours a day. Don't use them 16
If you
hours.
feel that you're getting so tired of the heat, just wear your glasses. Eye protection through sunglasses obviously is quite important. Use artificial tears. You can get them over the counter. Stay well hydrated. Take regular breaks from the screen.
Yeah.
Ensure you're staying cool. and have a healthy diet. It includes oily fish, leafy greens. You can have omega-3 supplements if you know yourself to suffer with dry eyes. Basically all common sense things.
Yes. And then sometimes in the heat and you're sweating and you can't wear your contact lenses, can't wear your glasses, then consider laser eye surgery.
Okay, little plug there about refractive eye surgery.
Yes. But that's another episode which we'll be doing soon.
All right. So I think that was fun.
Yes, that was good.
Despite of the heat.
Yeah. And we're sitting now in air conditioning. I'm feeling my dry eyes already getting worse. So
maybe it's time for your dry eye drops.
Yes.
Well, thank you.
Thank you very much for joining us. And we'll see you in the next episode.